Good morning, one and all. So, we are live here at Aster CMI Bangalore, and today, continuing our tradition of these FP Lives, wherein we are sharing valuable information to all our viewers. Today, we would be discussing another important topic, and that is how do you manage chronic illnesses or chronic diseases during this pandemic. So, to discuss this important topic, we have with us here Dr. Raghuram, who is a pediatric hemato-oncologist and a BMT expert at Aster CMI, Dr. Shrikanta, our pediatric pulmonologist and expert in sleep medicine, and myself, Dr. Sagar Bhattat, a pediatric immunologist and rheumatologist. So, to begin this discussion, I'm sure we all know that when children or adults have diseases, some of them are short lasting. For example, somebody developing a dengue fever in this season, we believe they should get better in a week or maximum 2 weeks. But then there are certain illnesses wherein children and adults, that means these patients need continued care for months, for years, and sometimes for life. To discuss this, I would want to ask Dr. Raghuram the very first basic question. When we use the word chronic illness or a chronic disease, what do you mean? What do you mean by this?
I think you have described it exactly. Most of the illnesses which come in children are infections, and they are what we call acute. That means they come, they last for a few days, child gets better. Suppose child gets loose motions, what we call gastroenteritis or pneumonia. In the normal situation, we expect the child to be sick for a few days, maybe 3 or 4 days, and the child gets better. That's what we call an acute illness. Even if it gets prolonged for a few days, maybe 10 days or something, but we don't expect the child to have the problem for months together. But there are certain diseases or certain illnesses which happen in children, which the disease goes on for a very long time. Just as you said, it can go for months or sometimes even lifelong. And these are the things what we call chronic illnesses. Here the child lives with the illness. It's not like the child has a problem, child comes to the hospital, gets better and goes home. Here we are managing the problem, that means the child lives with the illness what it has. And which usually come into these are like asthma, or the child has got diabetes mellitus, or sometimes in my field it's mostly blood problems like thalassemia. The child will need repeated blood transfusions. Unless the child has a bone marrow transplant, child is going to live for a long time with blood transfusion. That we call a typical chronic illness. Or some of the children who are undergoing treatment for malignancies. Even though it's a short period, it's slightly prolonged in that the child may be on treatment for 6 months, or sometimes in leukemias for 3 years. So here we do not expect the child to be in the hospital. We are expecting most of the times we expect the child to be in the community, has the illness but continues to live, and we are managing the illness. These are the children what we call children with chronic illnesses.
Okay, so Dr. Shrikanta, in your practice, you deal with a lot of children with, I would say, issues with the lungs or the respiratory system. What are the chronic illnesses that you see in your practice?
So some of the chronic illnesses that we deal in our respiratory system is, the most commonest is asthma. So asthma is a lifelong disease, and asthma still continues to be a significant burden, at least in India. Apart from that, we have allergic rhinitis, which continues to take up significant amount of time as well as a significant amount of financial burden. Apart from that, we have bronchiectasis, children who continue to have persistent wet coughs, children with cystic fibrosis, children with gastroesophageal reflux disease who had presented with the bronchiectasis and continue to have problems, children with interstitial lung disease. So these are the usual common chronic problems, and these are something that are there with the children for life and has to be managed and monitored sequentially as the child comes with exacerbations and with infections. So usually these are the commonest diseases that we find in our children.
So you can see that it's not a single disease. What we are trying to highlight is that there are a number of diseases in children where the child needs to be on treatment and on regular follow-up with their doctors, sometimes for months and sometimes for years. For example, in my practice of rheumatology, I would see several children coming with arthritis, wherein their joints are swollen and the joints are stiff, they have difficulty in walking, and they are put on medications, and they do really well on medications. Sometimes I find it difficult to convince parents that children do develop arthritis, because most often they feel this is a disease of the adults, but that is not the reality. The truth is, children do suffer from a lot of chronic diseases, and these diseases not only have an impact on the child's life but the whole family. Naturally, the parents go through a lot of struggle when the child is diagnosed with a chronic ailment, and sometimes even diagnosis is not straightforward. We have seen families with immune deficiencies where the immunity of a child is low getting hospitalized to multiple hospitals before a diagnosis is made. So you can understand the problem is not only with the treatment, but sometimes even the diagnosis itself can be challenging and can lead to a lot of financial, emotional, social drain out in these families. To understand this better, I would want to ask Dr. Srikanta, I said social challenges. So what are the social challenges you anticipate in a family with a chronic ailment?
Right. So basically, as this is a talk during pandemic, and this is a talk that we are giving for all children with chronic illnesses during pandemic. So I would probably restrain my talk to the pandemic per se. So what we are looking at and what we have been facing in the last 6 months to 8 months is first at the home level and then at the community level. At the home level, what are the social challenges that we have faced is foremost is social isolation. So children with chronic diseases would go to school, would at least socialize with their friends, and they had that new normal because a chronically ill child looks different if the child has significant issues and also feels different, is not able to do the same things that the child might do of the same age group. So with a social isolation of months of lockdown and then schooling at home now, the significant number of children are finding it difficult. And a lot of children are facing a lot of issues in terms of coping with these social isolation. One. Second thing is definitely a transition from school-based teaching to home-based teaching and online teaching. That is also taking a significant amount of toll. So initially we had a consensus where we did not want to go to school, we did not want children to go to school for the fear of catching virus. Now again there's a public forum where people want to send their children to school because everybody started working and everybody wants to work. So again, that has a significant amount of social issue in terms of child schooling. So they are kind of caught in between by parents, the school teachers, and everybody about what is the best way of the school teaching per se. And third, most importantly, they are not exposed to a platform where they have to sit in front of a laptop or sit in front of a tab to listen to the teachers, and most of them are finding it very difficult in terms of learning online and going ahead in terms of their career online. And third most important social issue that we are finding is parents, particularly from the IT sector, are having less amount of time now because work is coming to the house and most of the time is being spent on the laptops now. And because most of the time parents are working, say from morning 9 o'clock to evening 7 o'clock, 8 o'clock, or even probably 9 o'clock, they're spending less time with the children. And I've had parents coming to us and telling us, see, because of the current issue and current scenario, we are either being overworked or we do not have time to our children. So children are becoming more crankier, they are becoming more socially distanced from their parents, and they are finding it very difficult to give at least a couple of hours or 3 hours to their children. So this is at the home level. When we talk about community level, so most of the children who were following up with us have significantly been disrupted. So children, imagine asthmas, children with bronchiectasis, children who have had sleep-related issues, they were following up at least every 3 months. And in the last 6 months to 8 months, we've not seen even a single follow-up. So what we want to tell all those parents is, even though the disease is under control, it doesn't mean that it might not flare up or it might not come back again. So we are available on phone, we are available on teleconsultations. So we would want parents to take up that platform to at least be in touch, at least to let us know how the child is doing, what is happening to the child, are they taking medications, are they doing everything. And apart from this, the other thing that we have found is management of these children. So what happens is, I'll take an example of asthma. So children with asthma, because they are on medications, they are better. They do not have exacerbations. Their daytime, nighttime, and exercise-induced activities are perfectly fine. But what parents think is, yes, because the child has not had problems for 3 months, let me just stop the treatment. They do not realize that weather changes, a slight infection, any sort of viral infection can trigger them to have a wheezing episode, and that can cause significant amount of distress in the social circle as parents have to skip their job or have to take a leave on that particular day. Either they have to teleconsult or they have to come in person to meet us in the hospital. And now, being a COVID pandemic, everybody will be tested for COVID. So all these issues starts creeping in. And due to pandemic, the last thing that we were really worried about was disruption in the chain of supply of medications. So somehow things have been reasonably good enough and medications are available. The only problem is currently medications are being given only with a prescription in most of the pharmacies. So again, without a prescription, without a proper follow-up, children are not getting prescribed drug, particularly the inhalers or the medications that we usually prescribe. So we do see a lot of social issues that are creeping up in this particular pandemic, from home to community to hospitals, and we definitely want everybody to utilize services which are currently available and not become a person who's lost to follow-up in this particular pandemic, which is going to eventually cause significant issues in the coming days of this particular child.
Yeah, I think that is very well said. I think Dr. Shrikanta covered a lot of important points for us here. Number one is that a child with a chronic ailment needs regular medical follow-up. Now, that is quite important. The reason being that once these children get better, often we start becoming complacent, and that is where problems creep in. The other important stuff which I realized was missing not only school but even for parents. Sometimes every 3 to 4 months they have to miss a day from their job. So this is another important social challenge that we have with this chronic ailments. However, these days, due to availability of e-consultation, I'm sure at least if your child is doing fine, do not miss out on reaching out to your respective doctors, because sometimes change of medication is needed even when children are doing fine. Also, I find a lot of these children and the families have social stigma because their child is suffering continuously, they are on some medications, they kind of do not want to share it with their friends or in their schooling environment. I would feel that there has to be a balanced approach to it. Your teachers especially need to know that the child is suffering out of these illnesses so that they are prepared to react once the schools restart. So I think that is another message we would like to give, that don't get stigmatized, because just like hypertension, diabetes, these are chronic ailments in adults, asthma, arthritis, and there are so many other chronic ailments in children. One needs to learn living with them. Not only social challenges, we do have a lot of financial challenges because this is ongoing care, and we also discussed that parents do miss out on their jobs sometimes. So how do you go about the financial challenges, Dr. Raghuram? And do you offer some solutions, especially say you said a child with leukemia or a blood cancer, to put it simple, needs a 3 years long treatment? There would be financial drain out. What's your experience with that?
I think during the COVID times, I think the finances has become an issue, because there is constriction of the economy, a lot of people have lost their jobs. Or even for people who have not lost their job, there is uncertainty regarding what is going to happen. Because of this, especially in the field of hematology or oncology, where the child needs long-term treatment, sometimes there may be sudden exacerbation of the conditions or complications where there may be more need for hospital admissions or complications happen. Then this is where the financial issues come into play. Not only a chronic illness puts an extra burden on the family, apart from what the family has got, the routine expenditure of the school, taking care of the food and all, children with chronic diseases have got an added expenditure of the medical expenses. Not only that, sometimes when these complications happen, or because of this, the expenses can go up. There are lots of things which can be done. And also, one of the other problem is people losing their jobs. They would have had an insurance cover which they will lose, and that will also can lead to problems. But the main important thing is some of the diseases need to continue the treatment. Okay, for suppose leukemia or a malignancy is there, we cannot stop the treatment because of the COVID pandemic. Because when the disease is under control, we need to continue the treatment so that we will have a successful outcome at the end. And also there are a lot of problems with the children coming to the hospital, because in the initial periods of the pandemic, when there was transport problems, a lot of the people could not come to the hospital for treatment. And there is also a lot of fear that if they come to the hospital, they may catch COVID here, or they want to be at home. But these are certain conditions where if you are having treatment for leukemia, or if you are going to need a blood transfusion for thalassemia, or if there are complications with any of these things cannot wait. Even if there is COVID, there is fear of COVID, these children need treatment immediately, because otherwise the disease is going to be more riskier than the fear of the COVID. So especially for cancers, the treatment of cancer, every guideline has told that the treatment of cancer should continue, especially curative cancers, where in children most of the cancers are completely curable, and these treatments should not be abandoned or delayed because of the fear of COVID or transport problems. Of course, we can come up with a lot of help. One number is the children who cannot come to the hospital, some of the treatment can be done at home by teleconsultations. And also, coming to the financial issues, now there are lots of help which can come. Right now, we can the hospital can help with the expenditures, and also we can the other help can from other things like pharmaceutical companies can give medicines at a subsidized rate, or we can through social media we can collect a lot of money for the continued treatment. But the important thing, especially during the COVID period, is not to abandon treatment. Okay, because these are curable diseases, curable cancers, where the outcome will be good, and delaying the treatment or abandoning the treatment will lead to bad outcomes. And just because of the COVID pandemic, we should not be discontinuing treatment or delaying treatment, especially for completely curable conditions.
I think Dr. Raghuram has given us very, very important message. I think all of us here want to highlight, if we can give one important message, is that discontinuing treatment can cause more harm. All of us know that there is a risk of COVID exposure when we come out of our houses, but by taking regular and necessary precautions, we can prevent COVID. But nobody can really prevent a flare of your ailment or of your problem if you are not on medications. So you will have to take a balanced call, a balanced risk. That is what I would say. The other thing is about the financial drainouts. So I am sure we deal with a lot of children with immune deficiencies. For example, in my field, there are parent organizations. At least in Bangalore, we have a very good parent organization for primary immune deficiencies, and that patient welfare society supports them emotionally, socially, and sometimes even financially. There are NGOs who come up especially to support children, because we have a lot of attachment to children, and there are a lot of companies who do this, what is known as the CSR activity, and through tapping those companies we are able to support a lot of our children for medical treatment and continued care. To add to this, I could even say we have a sick kid foundation called Aster CMI Foundation here in Aster, wherein a lot of children, especially who need acute care and sometimes continued care, are supported. So I think there are a lot of good people out there in community. We need to reach out to them, and we can help these children with chronic ailments, because they need a lot of financial support as we treat them. Now, it's not only about the financial challenges, there is a lot of emotional challenges associated. One thing was the stigma that I was talking about. So Dr. Shrikanta, can you just tell us, I have seen a lot of families having a disturbed atmosphere. See, you have a child with asthma, every now and then they have to visit a hospital, the father is occupied with his job, and the mother may be single-handedly sometimes managing the ailment. It becomes a lot of challenge within the family dynamics. So how do you counsel such families?
Feeling of sadness, feeling of depression, feeling overwhelmed is quite common in every family. It's quite common in both child as well as adult. But this feeling will come and go, isn't it? But now currently we are living in a time which is very difficult and very different. So a lot of emotional issues are creeping up in the family. So it can be related to their schooling, it can be related to their work, it can be related to day-to-day, what they see on television, everything. So everything that is happening around us, particularly in this COVID times, is having a significant emotional impact on everybody. But nevertheless, what we are seeing is children with chronic illness are getting affected significantly. So first thing is they coping up with their own illness. So first of all, what I want to tell all the parents is, see, if you have a child who has a chronic illness, please be open about the illness to them, because being open about the illness to them and making sure that they understand their illness is going to go a long way. So by this, what I mean is children are very resilient. they will understand that they have a problem, and they will make sure that they comply with whatever you tell them when they understand that there is a problem. Imagine you have a child with asthma. You do not want to mention that particular child has asthma, and you just want the child to take asthma medications. Over a period of time, the child is going to get bored, isn't it? Why should I take medication when I'm feeling good? But if the child starts understanding, and you start making him understand that there is a problem, and this problem requires you to take the medication for a little longer time, and tell them that what happens if you don't take these medications, then child is going to stick on to the medications, and also make sure that you give them some incentive when they take those medications. That's a very important thing. The second thing that I want to tell you is, no child is going to show that the child is sad or child is in depression, isn't it? No child is going to ever tell you that I am sad or I am depressed. The only way that they are going to tell you that they are sad or depressed is by becoming socially isolated. So they become socially isolated, they don't talk to you, sometimes they become really angry. This happens more with the children who have bronchiectasis or cystic fibrosis, or in Dr. Sagar's primary immunodeficiencies. So because they have to undergo physiotherapy, they have to undergo nebulizations every day, they look at the other peer groups and they become really frustrated. They do not know how to share the news with them, the news with the parents, or share with their peer groups. They become socially isolated. In those children, just asking the child, how do you feel? See, there are children who have these problems and they have these kinds of issues. So how do you feel about it will be a good starter to start with. And secondly, most importantly, please understand that you tell your children, if they have a chronic illness, that this problem is going to stay, and this problem is going to be treated as is currently being treated for a little longer time. And believe me, the children will accept it, and children will make sure that they do those medications, because they start feeling that after doing the medication, I am feeling better. After taking the medications, I am actually normal. So they start becoming more and more comfortable with it. And coming to the problems of education. So they will continue to have pains here and there. They will continue to have a little bit of exacerbations here and there. So again, reinforcing that you have to take those medications from not only preventing yourself from getting infected or getting exacerbations, but also leading a normal life is going to go a long way. If the child continues to have significant depression, that is social withdrawal, doesn't want to mingle with others, doesn't want to mingle with their peer groups, or even do not want to get involved in activities that the child likes, then definitely we have child psychologists. So always get back to your pediatrician, always get back to the specialist who's treating the particular child, and make sure that you get the doctors involved as soon as possible, just to make sure the doctors can understand what the problem is. Sit in counseling with either parent or parent and child is going to go a long way in terms of not only making sure that the child is significantly taken care of, but also make sure that the child doesn't carry on this burden of significant issues to his adolescent age group, which will become even more difficult as the child goes on.
Yeah, so I think talking to your child is very important. That is what Dr. Shrikant is trying to highlight. Yeah. So, if you have to tackle a child with a chronic ailment, what I could say is the first thing you will have to assess, as you said, is your child prepared to listen? I mean to say, you have to assess by his age and by his understanding. We have seen children as young as 6 to 7 year old start understanding that they have something that is long-standing as compared to their peers. So it is always better that we start releasing the information stepwise so that they do understand. Nowadays, with ready access to internet, children go on, I would say, internets and just type whatever disease you have written on the paper and they read stuff. So it's not only the parents. These days, the challenge is with children reading back and coming and asking us questions. Now, in that particular scenario, I would want to add, don't tell your child, no, this is not something you should read. No, let him read, but then tell him to ask questions. Ask questions to your physician and ask questions to you. So we can provide as doctors the necessary websites wherein they can get the relevant information, and we have to give information in a graded fashion so that they feel comfortable talking to us. The more they talk, the more they vent, it is going to be easier to handle their emotional stress. Dr.
And also,
Raghuram, yeah.
there is a lot of misinformation on the internet, or
Correct.
not all the websites provide the right information. So it is our responsibility to give the right information and to guide them towards the right websites which will give the correct information, because it's more difficult when they misunderstand things and come to wrong conclusions. And also taking the questions on the...
Yeah, you can take up the question.
Yeah. They're asked what are the chronic illnesses which makes you more susceptible to COVID. I think typically the COVID is affecting mostly adults. In adults, hypertension, diabetes mellitus, you are a cancer survivor. These are the things, and your old age more than 60 to 65 years are the ones which makes you more susceptible. Not only more susceptible, if you get it, you are more likely to become sick. Whereas in children, there was apprehension that yes, if the child is having a chronic illness, like child is undergoing treatment for cancer, that would make them more susceptible to COVID infections. Luckily, what we have found is, even though theoretically it would seem logical that a child who is immunosuppressed, whose immunity is less because of the treatment they are undergoing, they would become more susceptible to COVID. Luckily, children have not been that much affected, and we are not seeing very severe infections of COVID in children, especially in the immunosuppressed. Not that it means they are not going to have it; they can get it, but we are seeing much less than what we would have otherwise expected. But in children, I think again, more we are worried about, rather than the COVID infection, the later effects which can come, I think you can describe.
Yeah, so I'm sure there is a lot of fear amongst parents. We have seen recently when COVID parents get admitted, obviously it's very much natural that more than themselves they are concerned about their child. And the good thing is, majority of the children who are kind of getting hospitalized even for observation for COVID go out well. Most of them have fever for a short duration, viral symptoms of a typical viral fever, and then get better. So the good news out there, as has been there right from the beginning of pandemic, that majority of children are handling COVID well. However, a small proportion of these children, I'm sure you have read it in papers these days, are coming back with multi-system inflammatory syndrome, which typically happens a month after their COVID exposure. They come with high fevers, rashes, sometimes red eyes, and sometimes they are very sick and their blood pressures are low. Again, let me not scare you. This is a very small proportion, number one. Number two, we have treatment available. And number three, majority, I would say more than 99% of them do well if we treat them in time. So if your child is having fever, do not sit at home. Go out and consult your doctors, either by video consultation or by direct consultations, and we most often would try to find solutions to the problems. And again, I cannot highlight, because we have been discussing throughout, that compliance to treatment in long diseases would be very, very essential. Do not miss on your medications. That is one thing, if we can send across as a message, we would have done justice to these 30 minutes that were given to us. Also, there is a need for holistic care. I would want Shrikanta to quickly touch upon, what do you mean by holistic care? I mean to say, when a child walks into my OPD with arthritis, it's not the rheumatologist alone who is going to treat. There are so many other people who are involved. So what do you put holistic care as?
So I can talk about diseases like asthma, where just prescribing medications is not enough. For me, prescribing medication means prescribing inhalers. So first thing is for me to do is not only prescribing inhalers, but also make sure the technique is right, compliance is right, and the child is taking it. Every time the child comes to the OPD, I not only make sure that the compliance and technique is checked, I also reinforce the real value of taking the medication, and also tell the parents as well as children that disease-free survival or quality of life is as important as their studies and other things per se. Apart from this, the other things that I also tell them is, see, when we talk about asthma, we also have something called as asthma support group, wherein children of the same age group or parents of children with asthma either talk on a forum or discuss in the forum about how to go about taking care of these children, taking care of their day-to-day needs, what to do in terms of exacerbations, what to do in terms of acute exacerbations, do we have medications at home, whom should we call, and what time is the right time for them to come back to school. Again, a support group. Support group is a very, very important part, because everybody has a busy life and everybody wants to have or wants to give the best to the child. But at the same time, make sure that there are people who will give you appropriate advices and make sure things are done in the right way. Apart from the support groups, we have the play groups. So children between 3 to 5 years of age who have asthma, we usually have a program where we ask them to come here, have a play group kind of a thing, because this will help them in intermingling with the parents, as well as the children with the same age group also know that their peer groups are also having the same problem, yet they are doing reasonably good enough in terms of their day-to-day activities with the medications, definitely. But parents as well as children will start seeing that I'm not the only one with this particular problem. At the same time, this problem is and will be treated appropriately by people around. And fourth most important thing is, when we talk about holistic approach, we cannot leave activities. So during isolation, social isolation, during the COVID times, people have been locked inside their houses, people have not gone outside, people have not been able to do things which they liked. So with the unlock happening, children are coming out, children are getting into sports now, children are playing their games as usual. So if still difficult, still you do not want to expose simple day-to-day activities, getting them to do cycling in the vicinity of your house, asking them to do yogas, simple exercise at home is going to go a long way in terms of calming their nerves, as well as making sure the body releases a few chemicals which will make them reasonably tolerable. See, for me, if I do exercise, if I have significant allergy symptoms, that starts getting better. It is the same thing that happens to everybody and every child. So these are usually the holistics, from support groups to play areas to, currently play areas might not be possible, but those can be done in a virtual medium now. You can have children of the same age group with the same problems meeting up on virtual medium and sharing their thoughts, sharing their ideas, teaching other child how to take medications, and teaching the child how better to get rid of the problems by taking the medication the right way, and then coming to simple things like doing yoga, doing simple exercises is going to go a long way taking care of these chronic diseases.
So I think Dr. Shrikant has beautifully highlighted all the stuff. So chronic ailment does not mean just between the doctor and the child. It is not that you regularly visit, you take medications and you're done with it. It is a Pandora of things wherein you have social, emotional, financial, psychological issues. And that is why you need support from the society. You need support from your family members. You need support from your peers. And definitely you need support from a whole lot of medical staff, not only your doctor, but other ancillary care, like even physiotherapy, for example, in chronic ailments become important. Dr. Agram, do you want to add anything last?
I think the message which should go on is chronic diseases are diseases which need long-term treatment, and just because of COVID, the treatment should not be abandoned or delayed, because these things will affect the long-term outcome. So I think if any one message to be sent out is, these are the diseases which need continued treatment, and even in the COVID pandemic, this has to continue.
Right, and if I have to give one message which I often give my, children coming to me, they ask me, is there a cure for these illnesses? So sometimes we have to say the reality. We have to tell them the truth that no, right now we don't have a cure for some of these diseases or many of these diseases. For example, with blood cancers, we have a cure. What we try to say is, after 3 years, your medication is going to stop and you would get better. But for asthma, maybe you will have to say you need continued medication for a few years and then you will be able to stop them. But then one more thing that I tell them is that science is progressing. 10 years back, we didn't even know some diseases existed. Today, we know that. So how can we say that there will be never a cure? So have that confidence in science, that today there may not be a complete cure, but maybe down the line after 10 years, you can have a cure. But your child has to be fit for that cure if that has to be applied at that particular point of time when it comes. So be hopeful, be positive. We can all fight these chronic ailments together. I hope we have tried to give you few messages. And I think that's a wrap for the day. And if the viewers have any further questions, I would request them to drop their questions in the comment section and our experts will get back to you. Have a safe day. Thank you. Take care.
Thank you.